Hi, my name is Greg Fell, I'm Director of Public Health Sheffield. This is a brief situation report on the epidemiology as of today, the 19th of October. Firstly, numbers. A lot of people talk about the 7-day incident rate. So as of yesterday, it was 371 per 100,000. That's a slight fall on this time last week. It's worth remembering that last week the numbers were in the mid 450s per 100,000. So we've definitely seen some stabilisation. We know, I've said before, that this is the increase in Sheffield has been principally, not exclusively, principally due to the 18 to 24 population. As I've said, we welcome tens of thousands of 18 to 24s back to Sheffield. They're called students. Even if you took the 18 to 24-year-old cases out of the Sheffield COVID positive population, we'd still have a rate that is too high. So this isn't principally, or this isn't only an issue of 18 to 24s. Principally, what we're seeing at the moment is infection in young people, but we know this is marching its way through the age groups. So as was observed by the ex-director of Centre for Disease Control over the weekend, we've seen it locally. The infection starts in young people and it moves up. So the 18-year-olds give it to their 30-year-old relatives in their household, who give it to their older relatives, and that's how this marches through the age group. That's known epidemiologically as stacking, and we have seen it across the world. We are seeing it here. It's very well documented in lots of studies, and we're definitely seeing that here. That's the key concern. Most young people, notwithstanding long COVID, will have pretty mild illness. Long COVID appears to be something that should be taken seriously, but most young people have pretty mild illness. But when it starts to get into the over 65s, that's when we start to become much more worried, and we are beginning to see that. It's important that we see the numbers in the round. So obviously a lot of the focus is on the 7-day incident rate, the number of people who test positive per 100,000. That's one of a number of really important metrics. Second one is the age-specific incidence, particularly, as I say, the number of people aged 65 who test positive as a proportion of the whole of the over 65 population, and that is going up. The rate of increase is going up in all age groups. As I say, some slight steadying, which we think is to do with a steadying in the student population, but we know that the age-specific incidence in over 65s is going up, as it is in younger age cohorts as well. Test positivity rate, so the proportion of people with symptoms who get a test, who test positive, as of last week was 22%. Worth reminding people that about 2 to 3 months ago it was 1.5 to 2%. So of 100 people with symptoms who get a test, 22% of them will test positive. There's an obvious implication of that one from a how we cope perspective, and you'll have heard me say before, treat everyone as if they have COVID, because if you do that, then accordingly you change your behaviour accordingly, and you're more likely to keep your distance and wash your hands regularly. Hospitalization is the other metric of a great deal of relevance. We are beginning to see increases in the number of people who are hospitalised with COVID. That's a mix of people who are in hospital for other reasons, but then test positive whilst in hospital, because it's standard practice to test people in hospital beds, and people who are admitted because of COVID. We're beginning to see increases in the number of people who are on ventilated on oxygen beds, and again that's a precursor to far more intensive care. We're not seeing deaths in any great number yet. There have been 1 or 2 over recent weeks, but not any great trend yet. But all of our expectations is sadly that will come. We're on an epidemic curve, and the curve is currently trending upwards, as is patently obvious. We are a long way from where we were at the height of the pandemic in midsummer, but we are on a curve. That cannot be stopped, but the shape of the curve cannot be changed. Whilst, as I say, we're not treating age groups as mutually exclusive, we know there is mixing in age groups, and that's one of the key concerns. we've seen that the surge in cases in Sheffield is the same as the surge in cases everywhere, principally driven by under 35s. There's no evidence that over 35s have driven the surge in cases, who are reporting more contact with more people. And I've said before that household mixing is the business end of where transmission is occurring. That remains the case nationally. It's definitely the case in Sheffield. We come back time and time again to how we interpret the guidance. I can very legitimately say the rule of 6, you could say you have 5 people in your house today, another 5 tomorrow, another 5 the day after. That's far more opportunity for the virus to spread, and that's where the mixing is occurring. That's where the transmission of virus is occurring. So again, we come back time and time again to the basics. The more social contact we have, the more opportunities there are to spread. Washing our hands, keeping our distance, wearing a face mask, staying at home if we've got symptoms. The best way, by far, to protect ourselves and our loved ones is to keep the spread of the virus low. The best way to protect NHS and social care capacity is to keep the spread of the virus low. It's likely that there will be more restrictions put on South Yorkshire at some point in the future. Difficult to call when that might be. We're currently in the high risk category. We may move to the very high risk category, moving from almost not many restrictions beyond national guidance to high risk actually is quite restrictive. It's worth remembering that Sheffield's taken an approach that's based on consent and consensus. Success or failure depends on the individual choices that 550,000 individuals make in private domain, and that will remain the course throughout. So what NZI will come back time and time and time again to the choices that we all make, and they are the basic choices.